Cases are rising
The
sharply.
actual number is thought to be
The death
much
toll
higher
from
than
Ebola
that.
has now reached nearly
The situation
7,000.
is getting out of
And by
control.
December, cases had topped 17,000.
Huge numbers might die, and there was panic. There were a lot of rumors about Ebola and treating it.
When you talk about Ebola, it's a death threat.
Ebola has no medicine. Ebola can't be cured.
I've spoken to people who said, we didn't believe Ebola was real.
We don't have any Ebola here, this man tells me. I don't know what is killing all these people, but Ebola is not real.
That's really the foundation for behavior change. If people don't believe that Ebola is real or how it can be transmitted, then those later stages of behavior change can't happen.
Our response was to come up with these programs very quickly, Kick Ebola and Kick Ebola Live, addressing the information needs of the people in terms of keeping safe, in terms of avoiding Ebola, in terms of where to get help, what to do. We commission reports from reporters stationed around the country, based at local radio stations. They know their communities well, they bring the issues, they record them, send them to us. We put them all together in a 30-minute program that is then distributed to 40-something radio stations around the country.
People just like to let people talk to them in their local languages. And when you talk to them in their local languages, you give them more opportunity to contribute. They feel that the fight is theirs.
On the program, we had a chair lady. She had done a song saying goodbye to Ebola and giving advice.
Chair lady in voice now radio, where you can talk about this Ebola, then where they sing back. I can call them while they listen to the program. I can call her, say, Mama Gladio. I say, right now, your voice down. Now they listen. So
This program is very, very special. It's important. Sociologically, it binds people together. Families living in different counties. It is helping the entire country.
One thing I noticed about this Kick Ebola, they help people for regain confidence. That is, in other words, not for relent. That program, they help you. They help you very much in so many ways in the fight against Ebola.
BBC Media Action engage with local partner radio stations to tune into the skills and the knowledge they have of the area to create very engaging, dynamic programs.
Ebola is new, so people were not trained, so they were saying different things, so we had to bring them together. We train journalists on behavior change communication, how they can change people's behavior through the radio. The journalists, they don't know the answers. That's why we train them to be the journalists and not the experts.
Traditional funerals where loved ones washed infected bodies became key breeding grounds for the virus.
One of the key challenges Ebola ever faced is about burying people. People just think when somebody died, they need to bury the person, they need to wash the dead body, and that is one of the key simple transmission by what the medical people said. So it was very, very more difficult. Thank God for BBC Media Action. They called us, they trained us to get the people know more about Ebola, sensitize them, try to clear the misconception they are having about this Ebola thing.
And they were sensitized through the radio that for anything, you have to call 117. You should not attend funeral. You should not touch dead bodies. For every call that comes into 117, it creates an impact in the public because for any call we miss, we take it as we lose one life.
And then once we kind of were able to raise that knowledge base, then it gets into, we now need to get kind of community buy-in.
We needed something that can at least revive us, give us hope that we'll be able to push Ebola away. So this is the way we've designed Mr. Plan Plan as a trader who goes about selling his goods. Well, it's not something to eat, it is his idea. It comes there and reminds the people that, don't forget, everybody needs to have a plan.
We can provide the scientific guidance, but we really need the platform to kind of express that, and collaborating with BBC Media Action was a great opportunity for us to do that.
the research was done, the information was collected, and other ideas we can bring in so that the drama will look so real, because we want everybody to see themselves inside what we are going to dramatize.
You want to beat Ebola, my people? When you plan, you can.
So many people now are having Mr. Plan Plan as their signature tune in their phones. It's the talk of the town now. You get plan here? Yes, I get plan.
Mr. Plan Plan, coming to your radio station.
Yeah, we take the plan, we take it down to the community. People play it, people listen to it, and they give us their own plan. If something similar, like what the person said into the drama, happens in the community, what would he do? They tell us.
Me, my own plan what I get, let this Ebola done, I can't tell her. But I see sick man, now this house, so me self are ready for this Ebola let done. I'm ready collecting, they give me this news.
That is then recorded and broadcast so that a wider audience will hear these messages coming from the mouth of their own peers.
You just listen to Mr. Plan Plan drama, where BBC Media Action they bring Cantona.
CDC kind of came back around to the need to address making a plan as complacency was starting to take place. And that big idea of the week started from those seeds planted from Mr. Plan Plan, ended up later on getting cited in a speech by the president.
To achieve any degree of success, whether it's in governance, accountability, health messaging, you cannot emphasize enough the importance that radio plays.
Now what we need to do is to use the radio to prepare the population for other emergencies, the health disaster in other areas. The radio can be used.
So it's really kind of helped move the entire response along through the spectrum of education to behavior change to empowering the community, and then really listening to what their continuing concerns and fears are.
So the way that BBC Media Action worked, I think, is critical, and it isn't really something that could have been recreated by an outside organisation, in fact, because the needs were so huge and so immediate that the benefit of BBC Media Action having these established relationships, knowing how to work with local partners and knowing how to overcome the many, many challenges related to media production were invaluable, I think, to the response.
And radio should be key and central to the success of any of these various interventions that could eventually help this country on the proper road to development.